Thank you very much, Lascar Herlock. Minister, you're welcome to the House to discuss this important matter. Minister, at the end of 2022, there was an announcement awarding €900,000 to dental schools for head and neck cancer treatments. This would have been the first time funding was made available for pre-radiation and rehabilitation of head and neck cancers. As you know, this was the only cancer that patients had to pay for their own treatment. In the Dublin Dental Hospital stopped charging head and neck cancer patients in March 2023 on foot of funding that had been announced. The funding announced was earmarked for dental schools in Dublin and Cork. Cork Dental School ceased offering this treatment, so the Dublin Dental Hospital put in a bid for around about 815,000 of the 900,000 that had been earmarked, which they estimated would be the cost to run the service. This was approved by the HSE group and the Controlled Dental Services Level Agreement and the NCCP. However, I understand that the National Oral Health Office decided, without consultation with the Dublin Dental Hospital, I should in fact call it the Dublin Dental University Hospital, the HSE or the NCCP, to review the budget and unilaterally reduced it to 315,000. That's a reduction of 500,000. In fairness, many groups have been trying to restore the funding, but over the last couple of months they've been totally exacerbated. So let's just recap, Minister. The Minister for Health announced an allocation of 900,000 of recurrent funding for the two dental schools for the treatment of patients with head and neck cancer at the end of 2022. The Dublin Dental University Hospital now sees more than 350 new patients every year, and this is on the increase, in particular new patients per year as a result of HPV in young people. So it's young people that are the increasing numbers. Before this funding, head and neck cancer was the only cancer that where the state's input ceased once the tumour was removed, and there was no funding for provision of rehabilitation. Patients paid for their own rehabilitation or went without it. The funding would have been a great start and hugely appreciated by the Dublin Dental University Hospital, working closely with the National Cancer Control Programme to develop and expand the much needed services. This really is the first step in developing a comprehensive service for this very deserving patient group. Ongoing resources is critical. Now, Minister, I have to tell you that I have personal interest in this because my daughter, when she was 19 years of age, was diagnosed with cancer of the tongue. She had radical surgery, and over the last 24 odd years she has been in and out of the dental hospital so often it's not funny. Today she's in the Eye and Ear Hospital, having encountered difficulties over Christmas with her swallow, and is currently being peg-fed through her stomach. What she has gone through over the last 24 years, I cannot believe the courage, the strength and the good humour of the woman. But the medical team that she has in the dental hospital are just an incredible group of people, and the patients they're dealing with are in the most horrendous situations, trying reconstructive surgery, etc., radionarcosis in their jawbones, you name it. So I really would like to hear that there is some positive news with respect to the Dublin Dental Hospital. Thank you.
Thank you very much, Senator Craughwell. Minister.
Thank you very much, Cathaoirleach, and thank you, Senator Craughwell, for raising this really, really serious issue. And I would like to wish your daughter best of health. It can't have been easy for her over the last 24 years. I had my own brush with cancer last year, skin cancer, and it's not easy when you're going through it. So I am taking this debate on behalf of the Minister for Health, Deputy Donnelly, and I want to thank you for the opportunity to address the issue of funding for head and neck cancer services. This government's commitment to implementation of the National Cancer Strategy is evidenced by significant investment in recent years. 20 million new development funding was allocated to cancer services, and 15 million was allocated for new cancer drugs in both 21 and 22. This increased total funding for cancer services in 2022 to €139 million. This funding has supported the recruitment of 393 additional staff to date to cancer services across 8 designated cancer centres and 18 systemic anti-cancer therapy hospitals. There has also been significant additional investment in oral healthcare services in recent years, including the allocation in Budget 2023 of €900,000, which you spoke about, to support the provision by the dental hospitals of reconstructive care to patients following treatment for head and neck cancer. This funding is available in full to the HSE, and the HSE engages with the dental hospitals on the use of the funding to ensure patients' needs for vital reconstructive work are met. The answer does not give me any detail in relation to Dublin Dental University Hospital, so I'll have to follow up after this. I wasn't aware when I read the question and the transcript of the answer that you would raise that, but it doesn't deal with that. But what it is saying is the funding is available in full to the HSE. Patients undergoing head and neck cancer treatment need a range of dental supports, as you know. They may need routine dental care before treatment to ensure they are ready for treatment. During cancer treatment, they may experience a range of dental or oral symptoms which are commonly experienced from radiotherapy and chemotherapy. Patients who have a medical card are entitled to access a range of treatments free of charge under the Dental Treatment Services Scheme for medical card patients aged 16 years and over. Head and neck cancer patients are eligible for a wider range of dental treatments under the DTSS, including periodontal care, additional fillings and dentures. Each dental hospital has an access pathway in place which allows them to provide care to medical card holders through the DTSS. Care can also be assessed via dentists in the community who operate the DTSS, but we know there are challenges there. Every effort is made by the HSE within the framework of the legislation to support applicants in applying for a medical card, in particular to take full account of difficult circumstances in the cases of applicants whose income may be in excess of the income guidelines. In such circumstances, the HSE may exercise discretion and grant a medical card. For example, discretionary medical cards issued to patients with significant medical expenses. Emergency medical cards are issued to patients that are terminally ill, and medical cards issued to persons who are terminally ill and have been certified by their treating consultant to having a prognosis of 24 months. A lot of detail there, but it doesn't answer the specific question you asked me in relation to, there was 900,000 allocated. I have been told in this response the funding is available in full to the HSE, but I will have to follow up in relation to the Dublin Dental University Hospital and the fact that you said they looked for in excess of 800,000, and I think you said 350,000 is what's been allocated. You might confirm that again.
No, Senator Craughwell.
Thank you very much, Minister. That was a comprehensive answer, albeit that you didn't have the full detail until you came here today. It was 315,000 they have been allocated, and in light of the fact that Cork University Dental Hospital has withdrawn that from that service, the only centre in the country now is Dublin Dental University Hospital. So they're looking for 815,000. Minister, I know, having listened to yourself and your own experience, beautiful young people going into the dental hospital, having been diagnosed, the radical surgery they go through, and the reconstruction. We have some marvellous maxillofacial and dental surgeons in this country who do a tremendous job of restoring these people to the beautiful people they were before the radical surgery. So anything you can do to give Dr. Michael O'Sullivan down in the dental hospital a reassurance that that additional 500,000 will be made available. It's shocking to think that there's an increase of up to 350 patients per year, and that a significant number of these are a direct response to HPV. And I hope that we send any message out today, apart from the funding, that we will send a message out that people should take up the HPV vaccine and try and protect themselves as much as possible. I really thank you, and I would appreciate it if you could come back to me fairly soon on it.
Thank you, Senator Craughwell. Minister.
And Senator, thank you again. I want to assure the House that the Government is committed to implementation of the National Cancer Strategy, as evidenced by significant investment in recent years. Cancer survival rates continue to improve, with around 215,000 patients living after an invasive cancer diagnosis, equivalent to 1 in 23 people in Ireland. And that's something that we really welcome. And also the fact that we do have the highest life expectancy in the EU, as deemed by the World Health Organization, doesn't happen by accident. And we know really good work going on across the centres of excellence in relation to cancer. Just one thing I suppose I just want to flag. So we know there was an initial 900,000 allocated, but we don't know how much of that was spent across other departments. I can't assume that all of it is available to one particular facility, but what we'll do is when I go back, I'll ask for an update in relation to that and see can we provide some clarity and provide some clarity for Dr. Michael O'Sullivan and his team, whom I know do phenomenal work, as they all do across the dental hospitals. But they're a very important facet, especially for someone who has to undergo treatment. It's amazing how the teeth are affected first and foremost. And it is really, I'm glad you raised it here today.
Thank you very much, Minister.